Welcome back to AM Northwest. For people who've struggled with weight loss most of their lives, surgery may be the best hope or solution, but here were some cutting-edge weight loss alternatives. We're happy to welcome back from Oregon Weight Loss Surgery, Dr. Emma Patterson. Nice to have you back.
Thank you.
So we've talked about lap band, we've talked about the gastric bypass, but now there's another procedure that you're investigating a little bit more. Gastric plication, what is that?
Yeah, gastric plication is an investigational experimental surgery that's kind of modeled after the sleeve gastrectomy, which is a third kind of approved and mainstream procedure where we make the stomach into a tube. And with a sleeve, I staple and remove 80% of the stomach to make it a long, narrow tube. Whereas plication, instead of stapling and cutting and removing the stomach, we take down some blood vessels along the side and fold the stomach in on itself. So it's kind of rolled up on itself like a hot dog and a suture all the way down. And so it's made into a tube, but no part of the stomach is removed, so it's potentially reversible.
I'm not a doctor, but it sounds like are you moving the stomach into itself?
Inside itself, yeah, folding it in itself. Yeah.
How does the stomach acids then affect the stomach that's been tucked in?
Likely then, I mean, the main thing is that with less mucosa or lining of the stomach touching the food, patients are less hungry. So there seems to be a real satiety effect. There's just a few published studies on this procedure, but patients seem to be losing weight similar to the other procedures. We don't know yet how long the weight loss will last and how safe it's going to be, and so that's why we're doing studies on it.
Yeah, but it sounds like a great alternative to the other kind of procedures too. Who would choose it, or why would they choose it?
I think someone would choose it who's just really interested in the cutting-edge new thing. And so I'm not actually doing the pure plication where that's a standalone procedure, but there's another version called the banded plication where we add it to a lap band. So I'm more comfortable sort of with this brand new thing starting out with that. So we do a lap band normally, and then below the band take down the blood vessels and do the plication or folding below it. And the theory behind that is it can kind of add a turbocharge to the band to give the patients less hunger and rapid weight loss immediately, like the other procedures, but then still have the band and the adjustability in case the tube or the plication stretches out later on. So maybe by combining these two procedures may add the benefits of both and hopefully still have the safety, and that's what we'll find out.
When you perform these procedures, the patients, do they decide which procedure they want, or do you, in consultation with them, recommend one over another?
I would say it's a combination of both. I mean, I really believe in individualized medicine, so my approach is, I mean, currently we have 3 very good approved procedures. I think they're all very good. They have different pros and cons, and if I had one perfect one, I'd do it for everybody. So my approach is to educate people about the 3, also tell them about the investigational ones, and for the most part they can choose. Sometimes there's different medical conditions or things that would make me suggest one over the other when we get into their details of their medical history.
Very good. And for more information, go to our website at KAT.com if you want to get any other information on weight loss surgeries. Dr. Patterson, always good to see you.
You too.
Thanks for
coming in. Thank you very much, sir.